I think I'm here. Hello.
Hello.
Good evening, everybody.
Hiya.
Lisa, you're all right.
Yeah, I'm fine. I think I am. Yeah,
We can hear you.
I can hear you as well.
Well,
I
there
can
we are. That's
I can see some faces.
excellent. Any joy, Bob?
Yeah, hopefully, if you can hear me, I can now hear you.
Yes, excellent.
Oh, good.
Ghosting
Your lighting
machine.
is not very good, Peter.
Can anybody else have? Is anyone else having problems hearing me?
No.
No.
Can you hear us?
Yes.
Yeah.
Yeah.
Yes.
You got your volume up.
Your lighting is not very good, Peter.
I've got a background that's
Very blurred.
suitably muted or distorted, so you can't see the mess of my office.
Oh, I see. Well, it looks very blurred and out of focus.
It is. That's the whole point. But
Oh.
you should be able to see me all right.
Oh, yeah, now we have. Now you've come. I don't know whether it's the light on your face or whatever. I don't know. Never mind.
Not to worry. Bob, are you happy with what you're doing? All right. We didn't get a chance to speak first.
I think probably. I think I've done this once or twice before.
You have indeed, and hopefully you got the note. So
Yeah.
right. Have we got anyone else waiting?
No, that's everyone.
Right. We've got a few more who've said they'll be attending. I'm surprised Sue isn't here. One or two others. Okay, well, it's time to go, so we will crack on. So, welcome everybody, and if you could just flip to the next slide, please, Nikki. Okay, so this is our AGM and annual public meeting, and we're going to be looking at the state of Southwood and Ferrers healthcare and related points in the context of the present situation of the world and the NHS on its 75th anniversary or abouts. Mac will be joining us round about 7:30, having spent all day at meetings in London, and this will be your opportunity to hear about things and to have your say about them. So if we could move on to the next slide, please. This meeting is being recorded and will be published afterwards, so if you don't wish to be visible, please feel free not to be. If you could also please keep on mute except when you're speaking, that would be very helpful so we don't get any feedback. And if you're able to use the raised hand facility to indicate if you wish to speak, that would be very helpful. And my trusty administrator, Nikki, will be keeping an eye on that to make sure I don't miss anything. Okay, so as chair of the Southwood and Ferrers Health and Social Care Group, I'd like to welcome you all. And I'll now hand over to Councillor Massey, who will kindly chair the AGM business. Thank you. So over to you, Bob.
Thank you, Peter, and thank you for the invitation as ever. And apparently, thank you, Donna, for handling this last year. I was otherwise occupied. First item on the agenda is to accept and approve the minutes of the AGM and public meeting held on the 14th of July last year. Those have been circulated. Has anybody any objections to those minutes, or can we accept those as agreed? If you're on screen, shake your head if you, or nod your head if you're happy. How's that? Okay. Silence implies assent. Let's do it that way. Thank you for
I
that.
haven't seen the minutes, so I can't comment on the minutes. Sorry.
Peter, were they circulated?
They've been published on the website. To be fair, the full recording of the whole event has been on the website all year. and the minutes are just a formal record of what was done. It wasn't, hold on a second and I will get them up.
We're from the Dengie, so we don't get them anyway.
Well, they're on our website. I'm looking at the wrong activity because obviously that was last year. So we go to that. And then we go to that. Right. Last year's meeting was chaired by our town mayor, Councillor Ely. The minutes of the 2021 AGM and public meeting were accepted and approved. The annual report for 2021-22 and appendices, including the report of the activities of the Voluntary Health and Welfare Support Scheme operated during the COVID pandemic, was formally accepted. The officers, as they are, were duly appointed, they being the only nominations. Councillor Ely kindly recorded her thanks and that of the town to the team of volunteers who delivered the Voluntary Health and Welfare Support Scheme to the town and surrounds during the COVID pandemic. A discussion was held to consider the future of this group's activities and resources. There was no other business relevant to the AGM. A full recording of the whole event comprising the public meeting and AGM is at, and then there's a hyperlink.
Perfect, thank you.
Right.
Given that, are we happy to accept those minutes?
Yeah.
Thank
Yeah.
you very much. Moving on to receive and adopt the annual report and appendices for 2022 to 23. The annual report runs to multiple pages, and the format of that includes basically copies of all of the releases done through the year. I think that's a reasonable description. Peter, would you agree?
Indeed, yes. As hopefully people know, we provide regular reports to Southwold and Ferrers Town Council, which are published by the council as part of the minutes and business of their meetings. And we use that to compile the report of what we've been doing during the year. And
yeah, runs to 13 pages. With a refreshing absence of block capitals this time. Thank you. Is everybody happy that we adopt those?
Mm-hmm.
Thank you. The next thing we have is some changes to the governance of the group, which is in Appendix 1. Peter, do you want to talk through those?
Yes, thank you. Sorry, I've pulled up the wrong set of them. So let's find the right ones, which are in here. Okay. The governance, there is a suggestion. As people will know, Focus now is only published every fortnight, and with the problems that
now £1.90. Quaker soft medium white bread 800 grams was £1.15, now £1. Cherries 200 grams was £3, now £1.90. Perfectly ripe avocado was £1.15, now £1.
Stu, could you go on mute, please? I think we're hearing about a baking thing.
Selected lines in stores.
Nikki, are you able to mute her, please? Thank you. Okay. Right. Yes. So it's in the past, we always said that nomination issues and announcements will be put in Focus, but the timing now doesn't work, I'm afraid. As many of you will have seen from the articles, I'm writing for a fortnight after events, before events, etc. So the suggestion now is that nomination notices will be issued on the website, on the town's, so that's our website, the town's social media, in the group's weekly newsletter, and as far as possible in Focus 4 weeks prior to the meeting, with nominations for office required 2 weeks before the meeting.
Yep.
And then when it comes to the venue, it used to just say our public meetings would normally be held in Holy Trinity Church, subject to availability, and we just added any then because we're not having so many. And in the final paragraph, we'd already agreed at the 2019 AGM that we'd moved to more online ways of working and increasing our use of the website, social media and virtual means. And we'd already added a paragraph saying this has proved to be timely as it has been invaluable during the COVID pandemic. And the addition is, and is proving to be popular since then.
Yeah.
Okay, so those are the items in the governance which require the approval of the meeting, please, Bob.
Okay, any objections to those? Silence implies assent. Thank you. That has been approved.
Thank you. There are some consequent just description changes in the role descriptions, but they're just for noting. Basically, that's just bringing things up to date with practice. So it stops Nikki being responsible for organising 4 public meetings and 5 management team meetings in person and such like, because we don't do that. As I say, things have moved on. I think everyone's happy with the way we're operating. That completes that item, I think. Thank you, Bob.
Well, the final item on that at the bottom is the accounts, I think. Appendix for the financial report.
Yes, the appendix 4 is the financial record and is coming up now. The only monies we've had during the year was a grant from Essex County Council, which enabled us to finish off the COVID support scheme up until June. Amongst that balance at the moment is the £5,000 towards which is to pay for the video documentary about the impact of COVID on dying, death and bereavement, which is now scheduled for filming in August and completion. By the end of the year, it will be before that, but we keep that. You've then got a list of all of the administration costs. And since we finished doing the COVID support, they have dropped, as have the travel costs. We've invested in a 2-year subscription to WordPress, which saved us 50% of 1 year's. The only other thing that's going on now, which I think is in the notes just underneath, is that we've got one new cost. MailChimp have introduced a fee of around £15 per month, which if we hadn't paid it, we wouldn't be able to send out our weekly and extraordinary newsletters all the time because of the restriction on the numbers we exceed. So we think that our weekly newsletter and extras are really important to go out to our subscribers. And so we will be paying that fee from now onwards. And as reported, our cash in hand is sufficient to assure our solvency and sustainability, certainly up to the end of the year. And we will be looking to probably a micro grant scheme from one source or another in the next few months to see us through to the end of this coming year, financial year.
Okay, thank you, Peter. Has that been noted by everybody? Don't have to agree, just but note it. Any questions for Peter on those? Thank you. Okay, moving on to the appointment of officers. The only nominations are for Peter to be chair again, David to be task force chair, Jackie minutes secretary, and they will doubtless appoint Nikki as the administrator going forward. With no other nominations, congratulations, you're back in the hot seat.
I can assure you, Nick is on an eternal contract.
Or infernal, whichever. Number 6, to consider the future of the group's activities and resources. Where do we want to go with that? Does anybody have any comments, anything they want to bring up in terms of what the group is doing? direction for the future. Could you raise a hand if you have any comments to make? Okay.
I think I'd like to pose a question, which is that I'm trying to discuss with the suitable town council leadership. It may have been noticed that I'm certainly not getting any younger, and David and Jackie have said that previously.
But you're not getting any younger?
Yeah, definitely.
Not the years, it's the mileage.
Yes. We know it's difficult to recruit people these days, etc., etc. But I think the time is coming, and we're certainly trying to work on sustainability. If the town thinks that this group is important to it, then, you know, various people have stepped up over the years, but some of us have been doing it for rather a long time. And we really do need to take some new people on board. The best way, obviously, would be to get a few people to join us in an enlarged committee, because it's fair to say that David, Jackie and I have been doing it for a while and therefore have gained a variety of experience, etc. We'd love to be able to pass that on. So I simply have to pose that question, really. I don't know whether you've got any thoughts on that, Bob.
I think you've probably, your best bet will be to sort of put that in one of your forthcoming missives, both online and in the focus, and see if that shakes anybody out of the tree. That will give you a clue as to sort of how well it's read and how far the interest goes. And I think you've also asked for a meeting with the leader and deputy of
Yes.
the leisure committee at town council.
Yes, because I mean, obviously, we've always worked very, very closely with the town council to enable really the council to be able to follow the health issues and welfare issues, which it's I understand is something that it wants to do, and hopefully we make that a bit easier for you.
Anybody else? I think that will be your next step, Peter.
Thank you.
Anybody other? Any other comments on the group's activities? Okay.
We have set out what we think we will be doing as our main activities in the coming months, which include things like the report, promoting the report, and dealing with things like the health aspects of the cultural strategy, and other things like that. Obviously, the making of the video documentary.
Mm-hmm.
So I think we have a good little list of things that we're involved with.
Yeah. Okay. And finally, on the AGM, any other business?
We certainly haven't been notified of anything. So in usual AGM terms, I would suggest that there probably shouldn't be any.
Okay. In which case, at 18:50, I will close the AGM and say thank you for your attendance and attention. And I will hand back to Peter for the public meeting. I have to duck out at 7:20, so I will be missing the keynote, but I will follow that on YouTube when it's published. Peter, back to you.
Thank you very much indeed for kindly chairing our AGM, as always, so efficiently. Much appreciated, and all best for your other activities this evening and forthcoming.
Thank you. I'm now going to mute.
Okay. Right, so we've got Matt coming along at 7:30 after his day at meetings in London. So last year's annual meeting raised the question of it was a while since there'd been a review of the healthcare services, and we therefore consulted with the local health authority as to what was the best area for us to look at in the circumstances in which we are now with the way that our local healthcare is organised. And so we agreed that we would apply for a master's research project from the Warwick Medical School to look at the primary care network of the Dengie and South Woodham Ferrers. And we were successful in our application. So the applications for this programme, it's an annual programme, so you put them in September at the start of the academic year. In December, you find out whether you've been successful or not. So we did. And then the project runs from then through till about May. It actually got extended to June. And so I am very pleased to say that we have published said report today. And it's, I think, a rich and comprehensive document. It clearly can't do everything, so it's not a complete survey, but for the first time in terms of published material, it includes as its main appendix a detailed health and demographic profile of the PCN area. And that in itself, I think, is a huge step forward, because that's something we've never had. Now, for those who can't remember, the primary care networks were set up just before the start of the pandemic and just before the move of all of the GPs in South Woodham went to the Crouch Vale Medical Centre. So unfortunately, for those good reasons, things have gone slowly until we've got past that. But then, of course, last July, we had the reorganisation of the local health service into the Mid and South Essex integrated care system, which is also added to it. So a number of people who are on this call have had the advantage of already seeing the report before today, because they've been involved in it. So the key people who we've involved have been the patient participation group leads for all of the GP practices on the Dengie and in South Woodham, and people from the Mid-Essex Alliance, being the local NHS authority, and more recently, some new, really enthusiastic new PCN staff who've been around for the last few months. And I'd really be grateful for some people who have had a chance to read it to reflect on the quality of what you think we've managed to produce. And I'm going to pick on Sue Hanscom first. Sorry, Sue, but I know you've read it because you came up with a possible typo, which I explained.
Hello, Peter.
Hello, Sue.
Hello. Yeah, I mean, I think that's what it does.
Sorry, I should stop. Very, very sorry. I should say Sue is. You can say who you lead a patient participation group, and you also chair the patient and public engagement group for the Mid Essex Place. Sorry, Sue.
Peter, that sounds a bit grand, and I'm not. I think that it doesn't tell us anything we don't already know, but it does highlight a lot of things that we should know. I hope that makes sense. And I also think, as you said, it's very interesting all about the demographic of it. That's all very useful stuff. I was very surprised how the amount of depression and stuff and mental illness there is around the Dengie. But actually, when I think about it, not particularly surprised, but I shouldn't have been surprised. So it highlights things that we should have known as well. That's my first impression. And also, I think Sakara's done a blooming good job. And I think all the references and everything she's done are very good and should be lauded as well. That's my first impressions, Peter.
Thank you. And obviously, we're a South Woodham Ferrers group. I've done my best to include everyone on an equal basis from the Dengie, and I hope you agree that it is as representative of the whole of the primary care area as possible. Sue? No, she's not going to say. All right. Has anyone else? Sorry, hold on a minute. Where are we?
I think he's froze.
Phil, have you got any comments on it?
Although we have got a copy of it, we haven't actually been through it yet. We've had other issues that we've had to attend to, which has taken priority over this. So,
okay. Catherine, have you had a chance to look at it yet?
I have. Hi, Peter. Nice to see you all. I think so my name's Catherine Smith. I'm the transformation lead for South Woodham and the Dengie PCN. And in my other role, I'm the fuller implementation lead for Mid and South Essex. I found it really insightful, actually, Peter. I think that the quality is there's been a huge amount of information gathered, and certainly for us, and I was I'm not sure if Smitesh is on the call. He will be on shortly. Smitesh is the clinical director over in South Woodham PCN, and Hayley Spice, who's one of our care coordinators. We were talking it through at a meeting earlier, and it's really going to help to inform the way we kind of approach health inequality, where we look at outreach, where we, it's going to shape everything we do as a PCN, and that in the kind of set amongst the landscape of integrated neighbourhood teams, which I'm sure Mac will talk about a little bit later on. But I'm certainly, we're very, very grateful for having this, and we kind of feel privileged because there's no other PCN that have got this level of information and data. So yeah, for us, it's really good and will help shape everything and the way that we move forward in, as you say, in South Woodham and in the Dengie areas, because they're both very different demographics and the approach needs to be very different. And why, as a PCN, we've recruited kind of 3 care coordinators, whereas most PCNs recruit 1, because we're mindful of that kind of the difference and the rurality issues over in the Dengie as opposed to South Woodham. So yeah, can't applaud it more, Peter. Absolutely great work.
Can I just interrupt, Peter, and say we really do need to thank Peter, because I totally agree with what she said. And for those of us in the Dengie who are in an isolated community, Peter has done such wonderful work for us. Thank you.
Thanks, Peter. Well done.
Well, I think I'm so glad to hear. Thank you very much. I think we were very, very pleased with Sakara. She has done a fantastic job. This is a lady doing her masters, who comes from Bermuda and has really picked up the nature of the UK system and our area, and really got to grips with the issues. We started off by having a discussion amongst all the PPG's leads to identify what we thought were the areas that were best to concentrate on, because we knew we couldn't do everything. And I think that's reflected. And I can only say I'm really pleased that Catherine, you and your colleagues are going to find this useful. Perhaps Hayley might like to chip in a little bit with how she thinks things are going. We were so pleased to meet her and Vicky when it came towards the end, when we were having one of our workshops about this. And it was really exciting to hear about the new staff and the things that were in plan and going to happen. And it would be interesting to hear your initial thoughts about how you think this will help us all to hopefully work together.
Yeah. Hi, Peter. Can you hear me?
Yes, thank you.
Yeah. So, yeah, I read the report today. I follow on from what Catherine says. It's the data that's put together and how it's put together is such a help, especially for myself. You know, I'm, care coordinator, lead of the team. So my job is to find out all these issues where we can support in social care and healthcare and where them inequalities are throughout the area. So thank you for that, because it has really helped. It will help me be able to improve what we do as a team. So, I agree with what Catherine's saying. It's fantastic. We really appreciate it. We are getting somewhere. The team is building. We now have 3 of us care coordinators who are starting to look at different services and new services for the area and finding out, what issues and where we can help. So things are moving forward, and this piece of work helps us to do that. So thank you, Peter.
Could you give us an indication of what you see as your present priorities?
Well, at the moment, we're looking at weight management and type 2 diabetes, because obviously we know, and pre-diabetes, and helping people to remission by using these new services that we have. So that's our main project at the moment. We're working out how best to refer people and who the best sort of area to look at. And, that's our main project. So at the moment, and then obviously moving forward, once we start that, we'll move on to the next, but that's our main focus.
And if I could just, sorry, Peter, it's Catherine. If I can just jump in on the back of that as well. And so kind of on a kind of strategic level as well, what we're trying to do is develop the integrated neighbourhood teams across South Woodham Ferries and the Dengie. And by that, we mean not just a health GP primary care focus, but aligning all of the services together so that the patient journey is more efficient. So we're working with trying to link in with the Dengie neighbourhood team, and our ambitions have always been the same from the start, Peter, and you'll know, but some of our challenges have been around workforce, which still seems to be an issue with some of our recruitment, but we seem to have a really good team now, especially our care coordinators on the ground, and they're starting to do some kind of outreach, working with our voluntary partners and third sector colleagues, alongside our health providers, with community services as well. So in the kind of background, we're trying to connect all of the dots to enable, so that we do, when we are focusing and we do look at what our health inequalities are, we're not doing that as an organisation on our own. We're doing that as a kind of as a group, trying to address the kind of wider determinants, Peter. We'll all know that health is just a small part of the big puzzle, really, and trying to bring our colleagues to support us in doing that.
Thank you. I don't want to hog it. Is there anyone else got any comments? I will keep questions coming. I don't think I can see anyone. Penny is our social prescriber. I don't expect you've had time to read it yet, but have you been involved in any of the discussions about how this might help?
Not really. I did have a little look through it, only very briefly, and I was actually surprised that the mental health side was so low. Which is different to what other people think, but I suppose I get people referred to me, with most of which have some sort of mental health issue going on. So it's disproportionate is the number of people that I speak to. So maybe that's why I might think that. But yeah, I've met with Hayley and her colleagues. So, and I actually did my first referral to Hayley today, hoping we can help a lady with weight management. So yeah, it'll be interesting going forward to see how we can all work together. As we spoke when I met with Hayley and Vicky, you know, hoping that we don't duplicate anything as well. So yeah, all good going forward, I think.
Yeah, I think that your work as the social prescriber is proving invaluable. And I'm sure you're right that you'll be seeing a lot of people who are starting to experience mental stresses and strains, and if you and others can help them at the early stages, then hopefully that will help them not to get any worse.
I do actually get a few people who are a long way down the line and are very severe. It's not really part of my role, but I think I deal with it more on the just trying to support them and encourage them to get some help, really.
Interestingly, a county-wide mental health strategy is being presented to the meeting, the public meeting on Thursday, I think it is, of this week. Yes, it is, of the Mid and South Essex Integrated Care Board. That I think is very positive. But the elephant in that room, of course, is the now to be statutory investigation into the county's health services, mainly stemming from the problems that have experienced at the Linden Centre. Mary and Phil, I can see your hand up.
Yes, a question for Penny. We're with the William Fisher Medical Centre. Are you our social prescriber, Penny, or do we have a different social prescriber?
The social prescriber over in the Dengie is called Leanne, but I don't know what practices she works for. Right. So I'm not sure if she's yours. Peter, do you know?
My understanding is she covers the whole of the Dengie.
Okay.
Right. Okay.
Yeah, that's Leanne Smith.
Thank you.
Sorry, that's right. So Leanne covers all of, you know, so although actually all of our social prescribers are employed across the PCN, so none are aligned specifically to practices, but because of the area, we align our two social prescribers to Dengie area and South Woodham area.
Thank you. Thank you. You unmuted us.
I think that one thing, it's a strange primary care network, ours. It straddles two local authorities, and they're two very different areas, for want of a better phrase, and that those of us who have been involved for a long time know that when it came to deciding the nature of primary care networks, our local authority strongly recommended, supported by everybody up the line until it reached national level, that these were two distinct areas which needed to be treated separately. But unfortunately, there was a government diktat that there should be 40 to 45,000 patients per primary care network, and neither of us were more than 20, 25. So they just said, no, you've got to work together. Fortunately, our local health authorities who've been with us since that time have recognised the challenges of this. I think to a certain extent, our report does also reflect that, although it's really useful to see the PCN as a whole, because that's where there are potential economies of scale, etc. One thing that I think is a very strong theme that's come out of this is problems of accessibility, and they are different, but they're both about that. So the Dengie suffers because it's far away, so it's difficult. They have difficulty having services go to them, particularly ambulances, and also public transport difficulties of getting to places because of also the lack of public transport and the distances. South Woodham also suffers from that in slightly different ways, but of course everybody is suffering at the moment through the challenges of accessing primary and acute care services because of the increasing volumes of demand and the waiting lists. Hopefully that's something that we can discuss. And also, I think another common theme is really about engagement. And I hope that the fact that we're now post-COVID or living with COVID, that this report will help us to improve the joint working between the patients and public and the local primary care network. And also help the individual GP practices to improve their relationships with their patients and their patient participation groups. I think we start from where we are and don't need to go over the history of it now, but hopefully this shows that us patient and public people, we do want to try and help, and hopefully we've shown that by getting this report done. Philip.
Yeah, the access to services doesn't help because, regarding the current situation, because the new medical centre that was well in progress, and it got to the stage that the William Fisher Medical Centre, the contractors were due to break ground this January, and now it's all been held up because of the inflation, and the project has become so, the cost has become so big that now it's in the balance of whether it is going to be approved. Now, this new facility was going to allow for visiting specialists to do something for the local people to overcome some of the access problems. Because our present facility is so cramped that you can't fit in any other of these ancillary services, although the practice is willing to invite them in. It's just an accommodation problems, and this new medical centre was due to solve some of those problems. But unfortunately, now it's really in the balance, and the deadline for getting an agreement is in August, and we're fast approaching it, and there's no sign of getting any decision from anybody within the health service. I personally have written to the Prime Minister about it. We've written to our local MPs. I've written to the directors of the Dan Doherty in the integrated care system, but we're getting no responses at all. Everybody is sitting on their hands, waiting for a decision whether the money is going to be made available. And when there's so much demand brought about by the housing developments in Malden and Burnham, that Malden are screaming out for new medical centres and more provision. So I understand the problems that the integrated care system have regarding what's possible within the budget constraints they have, but at the end of the day, we particularly in the Dengie, we are suffering because our local transport, and it makes us a deprived area because of access to all these other services.
I certainly agree, and I hope that that's an inequality which will be noticed and taken. I think there are a number of things which we highlight both in our annual report and in the PCN report. We've obviously got the situation in Malden with St Peter's and that. We've also got the Burnham new health centre that's required. We've got yours. And there are others certainly around in the mid-Essex area. Yep. We've got all of the housing developments, albeit it seems that some of those are being delayed because of the cost of living and inflation issues as well. We've also got the Bradwell power station. And then we've got the problem of the roads and how people can get out of the Dengie and South Woodham into civilization. So I think that is certainly an issue which is of concern to us all. I mean, a few months ago, we were being promised that things in Malden were going to happen, but that seems to have been delayed as well. So it may be that that's something we can ask Mac about a bit later as well. But certainly, I think when Catherine and Hayley and co are thinking about inequalities, they might consider cat therapy. I think if Penny's anything to go by, that's a lovely tale there. Anyway, yes, I'm sure it's very soothing. But
I think
seriously, I think inequalities do come in different shapes and sizes, and certainly this is one of them, and is a generic thing.
I think there's
Sue, you've got your hand up. So
Yeah, sorry. I was just saying that I've become a bit disillusioned because of all the cutbacks that they've had to do in the ICB. And like I just said, 1 in 4 losing their jobs, 38% got to be stuff. So I just think all of these projects that I've been so enthusiastic about, don't you think that they're just all going to be, well, axed or put on the shelf?
certainly the swinging cuts which are required of all integrated care systems around the country of 30+% over this year and the next financial years. So by 2020 April by March 25 really are swinging. I think that the approach that's being adopted by our integrated care system is that they are going to concentrate on the things that they are statutorily required to do, and they will concentrate on commissioning and getting those things addressed, but not by themselves. So they will continue to operate the distinction between commissioning and provision, which was established when we went to the CCGs, the clinical commissioning groups, as opposed to the people who were providing it, like Provide, the local services. But by integrating and getting everyone round the table who's involved in the health and care system, that will at least iron out duplications and hopefully start to address the gaps. I know that's the plan, but in the meantime, you're quite right that the reorganisation once again is interfering with the operational side of things. Phil?
One of the issues I raised with Dan Doherty was that all the developers who've been developing big housing estates are required to make some contribution to the infrastructure, and money's quite a lot of money from the developments in and around our medical centre have been made to the NHS, and the stipulation is when they make these infrastructure levies, the requirement is that the money must be spent locally to improve the local facilities where the development is taking place. So I asked him, well, where is all the money that was given to the NHS or required by the NHS to support the development? Where is that money being spent? Because it's definitely not being spent in and around the area that we are, where the development is and the way the community is being affected. So that's something that needs to be answered by the integrated care organisation and NHS England, because they're the ones that claim the money, NHS England.
Indeed. Smitesh, very glad you've been able to join us. Wonder if you've got anything you'd like to say about any of this?
Yeah, thanks, Peter. Sorry, I've got no video on where I am. Can you hear me okay?
We can hear you, yes. Whereabouts are you? Are you watching the waves lap over the coasts of the...
I wish I was. I'm in my office at the moment. I had a late clinical meeting that I needed to get to, hence my apologies for being delayed. But yeah, Yeah, no, thank you for presenting the report. I did catch the end of it, but I have had a chance to have a look over it as well. And again, some interesting reading. I like the, I'd reiterate what you were saying before about the two areas being, being very separate. And certainly that's something that we found as we've been trying to develop services within the PCN, and it was unfortunate that we had to go this way. Unfortunately, that is the edict that we have of joining the two together, and we're doing our best to try and cover the entire patch. I wanted to address the point that you mentioned about inequality. You're absolutely right. I agree with what everyone has said in terms of rurality being an inequality. Unfortunately, it's not seen as a clinical or health inequality per se. However, during our work, with Catherine and the team, looking at what we have to cover here, we have now made a significant case to say that, well, actually, yes, rurality is an inequality. A lot of the issues that we have, particularly in the Dengie, are around access, as you quite rightly said, partly because of the existing infrastructure and things like transport links, but also because you've got half of our PCN around in that area that are trying to access services quite far away, and we're doing what we can to try and extend the power that we have to provide those services over at the Dengie, and trying to eliminate that health inequality, if you like. But one of the things that I've done recently is try and get the ICS to look at rurality being an inequality, not only in terms of the service access and the provision that we provide, but also in terms of what we can give to the staff that need to cover that area. We would get the same amount of money, for example, for somebody working in the Dengie as somebody who might be working just outside London or in a South Essex locality, which means that staff recruitment becomes difficult because people are aware of that kind of area that they need to cover, particularly where we have visiting teams like our ECPs, etc. The choice becomes very easy to stay away from a PCN like ours because they've got such a massive area to cover. So yeah, absolutely, trying to make rurality as an addition to the core 20+5 inequalities that they're looking at the moment is one of our key sort of priorities at the moment. But yeah, I'm really glad that this piece of work was done, and it has highlighted certainly some things for us. Mental health is something that we've been working hard on, trying to get, again, secondary care to come out into the community to provide clinics and satellite clinics for patients across the patch. I also wanted to address the point you made about kind of infrastructure with ongoing development as well. Yes, I was very sad to learn as well that ground hasn't been broken on the project to do with William Fisher. We were hoping to be able to use some of their expanded space to be able to provide some additional services moved out into the Dengie area, which would be able to service that Dengie Peninsula and also help some of the patients within the Burnham area as well, and also sort of alleviate some of the pressure that's built up on the South Woodham practices in terms of having to provide capacity for all our sort of additional services. That is something that is kind of on a running agenda with the team over there. When we have an update, I'm sure we'll be able to let you know. I know that William Fisher are working hard to try and make that happen, as it was their kind of with our support, as it was their kind of project initially. But yeah, just to sort of summarize, I'm very glad that this report was done and it's been able to show us some areas where we can kind of sharpen up our focus a little bit, and yeah, no, I thank you all for being part of that.
Thank you very much, Switesh. Very helpful to hear, and we're right with you on rurality being an inequality, and also the mental health questions and the other things, and hopefully the patient public voice can join with the authorities' voices and keep making the cases. Donna, as town mayor. Oh, sorry. All right. That gives you a chance to think, because Mr. Birch is waving, so I'll let him speak. I just wondered if you've got any reflections, as the town mayor for South Woodham about any of this. but I'll let David speak and then come back to you if you'd like. David.
Just back on the report, Peter.
Yes.
Having worked on ONS data for 30 years, I think I can say that the appendices with the information in the data sets are robust enough to use as a reference document, so that people can take the information from this report and use it in other contexts without worrying about being challenged too much about the efficacy of the statistics. That's my comment.
Thank you very much, and thank you for your contribution to that, because I think that's a really important aspect of this, getting the profile. There's so much information in that. There's an awful lot of detail we can work on from this report. I was very pleased that Sakara was able to pull it together in her report. It was a great coincidence that one of the other courses she did before she started this one was about understanding these sorts of reports. And I must admit, when I first saw it, I found it quite difficult to understand, but she was able to explain it to us, and I thought that was brilliant. So yes. So Donna, is there anything you'd like to say on behalf of the residents and people of South Woodham?
Okay, so just looking at the report, I only received it yesterday, yesterday evening, and I've just had a quick look while some of you were talking now. It looks like a really good comprehensive study and report. I will look at the detail. We'll look at it in more detail probably tomorrow now. Mondays I have something else that I'm not able to do any work as such on Mondays. I look after my granddaughter, so I get tied up with that. But yeah, it's a really interesting and comprehensive report. So and it looks like something that can be really utilised by everyone involved. So the NHS, and also yourselves. Really, it's a good, a really good study. As far as anything else, I'm kind of quite new to, although I've been town mayor for 2 years, quite new to the council still, and also still new to really the work of the Health and Social Care Group. So I'm just observing really at the moment, and just taking everything in.
No, that's fine. Thank you very much indeed. I hope this is something that the town council can use as an example of South Woodham Ferrers once again, leading the way a bit with things. I certainly suggest it's not an easy thing to do, and of course it's quite resource rich or heavy, and there's only one of these sort of plans, but it could be a template for use by other primary care networks, and there are a lot of other universities with medical schools with masters programs, etc. So it would be quite, the other thing is that we've made it specific to our area. We did the groundwork at the beginning to identify what were the key issues at the moment for our area. And I think that's a really important part of any other area doing something similar. They've got to make, it's got to be made your own. It's a template. But so
yeah, I agree totally. But more important, we need to thank Sakara. Do we know if she's got her masters? And can we congratulate her from this meeting?
I will certainly pass all of the plaudits on. She doesn't complete her course until the autumn. All I can tell you is that I know that she got a very good mark for this report. I was actually one that I had to mark her, and obviously it was also marked by an outside. I mean, I think my views were worth 10%, and 90% went to the outside academic marker. But I know that the overall result was very good. There was only one. I mean, the grades went from excellent down to no good. I can't, but no. And she said, we had a debrief afterwards, her and and the academic mentor and myself, and she was very grateful for the constructive suggestions. I mean, I'm sure that she grew in confidence and ability through it, and she had a lot of different sort of research work. Having to go through the ethics approval was something that we hadn't foreseen, and that was a good experience. I think she's going to be going back to Bermuda and working there, but I think she'll be a credit to any public health work that she does.
Excellent.
I thought we were very lucky to have someone of that quality, and I will certainly pass on. I'll let when she's finished, she can watch the recording of this meeting. Good. No sign of Mac yet. No sign of Mac yet. Oh dear. Okay. Right. We will crack on. Did anyone have any other things? Let me have a look. What else? Yes. Anyone from the primary care groups? Is that a prompt? Nikki, is that a prompt?
It's Barbara Haran who's just joined.
Sorry?
Someone named Barbara Haran who's just joined.
Oh, right. Okay, fine, but not Mac. No, it's all right. I just saw the slide come up for Mac. All right. Okay. Right. No, I put the paper down that I was thinking of. Yes. Have any of you got any suggestions about how the surgeries need to, or how it will be best for the patients to work with the practices, the GP practices? Any thoughts about how that might happen, or how we might, how the PCN can engage in a sort of an ongoing way with patients and public? Don't shout at once. Yes, hello, Phil.
Yeah, we've been asking, because our practice manager was the treasurer of the PCN, and we've been asking for some sort of a meeting, regular meeting like we used to have with the Primary Care Trust, a regular meeting, because they hold the purse strings for this area, and we would like to have communication with the PCN and on a fairly regular basis, but not, so it's difficult for them. But we do need some sort of communication between the primary care network,
integrated part,
and the patient groups, because that is what's lacking.
Yeah. Okay. So we do think that there's still a need for patient and public, for patient participation groups with the individual practices.
Yeah.
Right.
I agree with that. And, our one has been going right the way through, since about 2011 when it was first formed. And I think it's been found useful, because we do, or up until the pandemic, we were doing regular annual communication questionnaires with the patients, and we have something like, well, over 600 virtual patients we can communicate with, and we get a pretty good response from when we go out with a questionnaire. So, we started off beginning by saying that we are representatives of the patients, and therefore we need to communicate with the patients. to represent them properly. We're not there to represent ourselves. So we put a big emphasis on expanding our virtual patient group so we can communicate better.
Perhaps I could ask Catherine and Hayley, how do you, oh, Catherine, you got your hand up, that's excellent. I was going to say, how do you see patient and public engagement working now as between the individual practices and the primary care network?
Yeah, so interestingly, Smitesh and I discussed this earlier as well around the patient participation. So we've got a slight challenge in the sense that we're a huge area, and we're not sure that creating one. So previously in other PCNs we've created one PPG. We're not sure that that's the right approach for South Woodham and the Dengie. I think on the back of what Philip said earlier, although yes, we certainly don't hold all the purse strings, but we're member practices aligned. So your member practices and your PPG should be feeding back to you what the PCNs are doing. And I'm sorry if that's not been communicated back. But what we'd looked at doing is to outreach with our PPG as well. So alongside holding a meeting, whether that's bi-monthly or quarterly, we would like to outreach, so kind of taking our team to the people as opposed to asking the people to come to us, and whether that looks like toddler groups, or I've known them to be held in pubs before, or to various different locations, just to really kind of spread that patient engagement so that we can capture all voices across. But I think that can work alongside having a kind of standard PPG meeting, if you like. But I would definitely encourage people to still attend their own practice PPGs also.
Good. Okay, well, I suspect that it might be a good idea for us to continue to work together on the report, because that is looking at the whole thing, recognising that there'll be some bits that do apply. But I think that I think you're right to recognise the differences between the two areas, and that there's a lot that can be done that way, and with the individual surgeries as well. I think that goes.
And I wonder if, Peter, there is some kind of value in us kind of producing similar to what you do, because we produce a PCN newsletter to the member practices about what's happening and who the new people are, and there's no reason why we can't kind of develop one for the PPG members as well, and that could be distributed via their member practices or by kind of, if people subscribe or kind of let it, not subscribe, pay, just let us have their email, and we can do that. But happy to work with all of you as to how we kind of move that forward. But I'm really keen for us to outreach for patient participation as well as holding meetings.
Great, thank you very much. Sue?
Yeah, I think that's absolutely fantastic. In fact, I met with Kirsty in one of her spring meetings and did wonder about, because I do a newsletter for the PPG, because it seems to be the one thing that we can do for our practice. So I do the newsletter for the Dengie and medical practice. Wondered if we could develop something like that for the Dengie if the other medical practices were cooperative. It'd be good. Brilliant idea. And that's what Kirsty and I thought.
Yeah, I mean, I think anything from that. I will certainly be aiming to convene a meeting in say 10 days, couple of weeks time, something like that, for all of us who've been involved, once we've all had time to digest the report and put our heads together about the best way to take it forward and use it, etc. So that will be an opportunity perhaps for us to think things out. Interestingly, the Kirsty that you're talking about, Sue, I presume is Kirsty O'Callaghan. And I have to say that the Prince of Wales pub at Stowe Maris is becoming quite a venue for Mid-Essex and wider meetings, but it's probably a bit not.
Of course it is.
It would be with Kirsty, wouldn't it?
Yes, she used to be a barmaid there. That's how I know her.
Yes. That's how you met her. All right. Well, here we are.
Yeah.
Yeah, she is.
I knew her when she was 19.
Oh, crikey. But hold on a minute. She's only 19 now, isn't she? That's what she told me earlier on today. Anyway, right, Phil.
Yeah. Going back to this business of communicating with the PCN, at one time, in the days of the CCG, we had a general meeting of PPGs about how the CCG communicate, because there's so many PPGs that they can't go to every meeting. So we suggested that we create clusters of PPGs, and that they establish a representative for that cluster who would represent them at a larger total area communications event. And this was the PPGs going in breakout groups and suggested this method, but the CCG just poo-pooed it, and that was it. So, you know, I think we need to act collectively within each of the areas, particularly the Dengie. You know, I tried to get a Dengie group interested, and we did start having PPG meetings with the various PPGs within the Dengie, but unfortunately, there were quite a number of the ones in the Dengie that didn't have a PPG group, and I even suggested to them that, you know, I could help them form a PPG if the practice manager was, you know, keen on establishing a PPG. But
yeah, thanks, Phil. Sue, I'm sure you're going to say what I would say. Go on.
Sorry, Peter, it's me again. I do apologise, but I think that's what MACE has become, and I think
Yes.
it's really, really good, and I appreciate it.
Yeah. So I think we've now got to the stage where we've got stuff that happens at system level. We've certainly got stuff that happens at alliance level. So we've got MACE, which Sue chairs, and which I think you go to, Phil, don't you, as well?
No, unfortunately, we missed it.
And then and now what we're talking about is doing something for at PCN level, and possibly halving that, so that it's the Dengie and South Woodham a bit. Sometimes we might be together,
Yeah.
and then also the GPs.
That sounds good.
Yeah, so I think we're getting there. It's unfortunately it has taken a long time to get the system up and running, and then of course the googly is the need for all of the savings. Right, I am going to make a suggestion. It is now 7:45. Mac has not been able to join us, and what I suggest is that we wrap this meeting up, and that I arrange to have a meeting with Mac, which we'll record, where I ask him questions. I got 3 questions, which are basically asking him what were his reflections on his experience of working with the NHS, and what were the good things and the not so good things, where he thought we were to where he thinks we are now, and what he thinks needs to happen for the future. So if you all agree, rather than us dragging this out for another 3/4 of an hour, when I suspect that most things that wanted to be said probably have been, but I'm very willing. Could you possibly take the slide off, please, Nikki, so I can see everybody, so I can actually see everybody? Yes. So, does anyone think that that's a bad idea or a good idea? Yeah, Penny's put her thumbs up. That's good. Okay. Yeah. Oh, and the Birches and Catherine. Yeah. Yeah. Okay. Because I'm sure we've all got other things that we could be doing, and I think we're probably starting to struggle a bit. So if we agree that I'll do that, I will do that as soon as possible, and I will make sure that you all know when it's been done, and we will post that on our website as soon as possible along with this. So is there anything anybody else wishes to say either on the subject of the report or anything else that you want to throw into the pot? Anyone got any suggestions for what the next report should be? Okay, I'm sure we'll think of something. I always have a conversation with the local NHS people about what they think might be useful. And I'm sure that I actually really enjoy doing these things. Personally, I find it really good to help the next generation developing and developing their skills and their interest, because we need the next generations of everyone who's involved in the NHS in their different ways. So I think, and I love working with the younger people and helping their education and development, and I think we really hit a star this year. So it is hard work, but it is enjoyable and worthwhile.
Peter,
yes, certainly.
would it be worth asking everyone here if they have any questions they would have liked to pose to Mac?
Oh, well done. Thank you very much. I tell you what, if you think of any questions that you'd like me to pose to Mac, for instance, about the situation with proposed developments and that sort of thing, if you send us an email to the same address that you've said that you wanted to for this in the next day or two, I will make sure that I ask those questions for you. So rather than you having to think about them on the spot, think about them in the next day or so. Send an email through, and I will include those questions to Mac when I get to speak to him. Thank you, Nikki. Very good. Anyone else got anything else they want to say? No. Okay. Well, thank you all very much indeed for your presence. And I feel that the last year has been very productive. And I think that what we've talked about tonight is going to help us in the coming months. So thank you all very much for your presence, and I wish you all a good evening and safe travels to wherever you've got to get to from where you are, which probably isn't very far really, but anyway, don't fall up the stairs anyway.
Thank you all.
Thanks, Peter. Thanks, Peter.
Night.
Thank you. Thank you.
Bye.
Thank you.